Everyone, Dr. Jeff, Audiologist and Director of Ear Care Specialists in Nottingham here. I'm also a clinical trainer and a former senior lecturer in audiology. So I recently wrote a piece, Who is Removing Your Earwax? All about earwax removal services and training provision and service providers in England. And I thought I would take the basic content from that article and turn it into a video. So right now in England, if you have earwax blocking your ear and you are seeking its removal, you will struggle to be seen via the GP and the NHS, following a widespread decommissioning of this service in many parts across the country. Now, some GP practices and walk-in centres will still look to irrigate ears, and just for clarity, ear irrigation is recommended, but it comes with many caveats and contraindications. From my point of view and many other experienced clinicians and colleagues, blindly pumping water into someone's ear without knowing what might be behind their earwax is just a bad idea. So I still avoid irrigation and I favour microsuction under a microscope or a loop. Now, anyway, this lack of dewax provision has led to a huge shift in ear care provision over to the private sector. And likewise, patients who may have previously been seen via ENT for ear cleaning are also often being told to go private as departments continue to battle with long waiting lists, clinical priorities, and staff shortages post-pandemic, namely. As the NHS staff aren't permitted to make recommendations about private healthcare providers, patients are often left with a tricky task of finding a suitably qualified clinician to remove their earwax and provide any accompanying audiological advice and management. So this second part is important because wax isn't always the problem. People think it might be, and then actually their ear may be completely clear and it's something else. So this recent surge in demand for private earwax removal has fueled a rapid rise in the number of service providers, from high street audiology chains to independent practices and individuals alike. If I could go one step further, I might liken this current landscape to that of the Wild West of wax removal. There are a lot of cowboys out there. So when it comes to choosing the right person for the job, patients should be asking one important question: who is removing my earwax? Now, outside of the ENT department, you'll most likely find audiologists and hearing aid dispensers offering earwax removal services. These individuals should have a degree level qualification in audiology or hearing aid audiology. They will be registered with the HCPC or the RCCP, and now as it's converted across AHCS. They should have appropriate liability insurance, and of course they should be competent in removing earwax. Now, earwax removal training delivered by most clinical trainers in the UK is very brief, and trainees can be out offering their very own earwax removal services with just a handful of earwax removal attempts under their belt. Now, this training pathway can function providing that the trainee is already suitably qualified and experienced in audiology, that they work within their recommended scope of practice, checking out the BSA guidelines, and they have continued access to an experienced supervisor. After all, we have to start somewhere. Now, for me, what is most concerning is the number of earwax removal providers out there who do not have the necessary background qualifications, no otology experience, they don't have the access to clinical support networks, or in some cases, they don't even have clinical registration. And alarmingly, a lack of hard regulation and blurred interpretation of national guidelines has signalled some unscrupulous clinical trainers to open the floodgates to a much wider demographic who work in areas far outside of ears and even healthcare. So while reputable trainers are choosing to be more selective by only allowing registered colleagues who are qualified to work in audiology onto their courses, others are not. and right now you can find beauty therapists, podiatrists, chiropractors, dispensing opticians, pharmacists, physiotherapists, the list goes on, all offering earwax removal services, having attended a very brief crash course in earwax removal. Indeed, even nurses offering earwax removal may be very experienced in their specific field of nursing, but may have actually very little experience of ears and otology. This poses a serious risk to trusting members of the public, not to mention imposing negative reputational damage to our profession. To a naive outsider, one may think that earwax removal is just a simple extraction procedure, so out it comes, problem solved, and off you go. And given the right circumstances with the right expertise and the right equipment, this can be the best outcome, of course. However, to possess the appropriate skills and knowledge levels requires months of practice, built on a sound pre-existing foundation of audiological experience. This often equates to several years of undergraduate training. So simply being able to look in a patient's ear with an otoscope and recognize normal from abnormal takes a long time, many months of practice and reflection, equating to hundreds of ears. And trust me, I've trained many audiology students and I've witnessed this learning curve firsthand. So this is just looking in the ears, let alone physically taking things out of the ears. And then, what if the problem isn't wax? I alluded to this earlier, and this happens a lot. What then? Well, audiologists are qualified to test, assess auditory function, to recognize and diagnose hearing loss and other related auditory disorders, and they have a far wider understanding of audiological care beyond simple wax removal. Any of the above professions that I've mentioned simply do not. Their ability to manage you ends at this point. So the assumption that any of these professions which I've previously mentioned could attend a crash course in wax removal and come out as competent and able to deliver a reputable de-wax service is just plain wrong. And to think of it a different way, you wouldn't go and see your optician for a back adjustment, you wouldn't see your physiotherapist for an eye test, particularly having attended only a 1 or 2 day course. So why on earth would wax removal be seen any differently? I hope you found this useful. Thanks for watching.